Welcome back to 3 News First Edition. May is National Stroke Awareness Month, and the Corpus Christi Medical Center is spotlighting a message that can save lives across the coastal bend, recognizing stroke symptoms early and acting fast. Dr. Fahim Sharif and Dr. Lianet Perez joins us. Good morning. Thank you so much for being with us.
Thank you for having me.
Of course. Dr. Perez, talk to us about what a stroke is exactly.
Absolutely. So a stroke, it's when an artery in the brain gets completely occluded and blood and oxygen cannot go into the brain. There are two different kinds of stroke. The first one and the most common one is the ischemic stroke. This is when the artery completely blocks and blood cannot go through. The second one is the hemorrhagic stroke. This is when the artery opens and the blood goes everywhere in the brain, but not where it's actually supposed to be going. Whenever someone has a stroke, in the first minute, they start losing approximately 1.9 million cells. So this is why we want to bring awareness of how important it is to recognize the symptoms and bring patients for treatment right away.
And speaking of symptoms, Dr. Sharif, how do we recognize symptoms? Talk to us about some of the warning signs.
Right. So there is a mnemonic or an easy way of remembering that may help our viewers. It's called the B FAST mnemonic. So the B stands for balance. Patients will have a loss of balance. They will be unsteady on their feet. The E stands for eyes or visual symptoms. They have visual blurring. They may have loss of vision. They may be looking off to one side more than the other. The F stands for face. So when you have them smile, they have a droopy face or an asymmetric smile. And then the A stands for arms. You have them lift their arms and they will have weakness on one side or the other. The S stands for speech, where they have slurring of their speech. They may not be able to understand what you're saying or may not be able to express their words clearly. And then the S in that mnemonic stands for time to call 911 and get medical help immediately.
I think that is a perfect way to remember at least most of the signs, and the timing is definitely essential. When we do notice one of those signs, what should we do?
So when we have the signs and symptoms of stroke, the key message to our viewers and to the public is to get in to medical attention immediately and not have any hesitation to call 911, get help, get into a medical center with stroke capabilities as quickly as possible.
Time is essential, like we mentioned before. Dr. Perez, if you can give us some risk factors.
Absolutely. So there are a lot of important risk factors that we should discuss, especially because they are very prominent in our community. Those are going to be high blood pressure, high cholesterol, uncontrolled diabetes, smoking, obesity, and lack of exercise. And these are all things that if we follow up regularly with our primary care doctor, we will be able to make sure that we have them under control by being on the right medications.
Important information that we shared with you today, and I am so happy that we're going to be having the very first annual Coastal Bend Stroke Walk and Run this Saturday. If you want more information on that, how you can get more information and talk to other people that are going through the same thing, join everybody this Saturday. We'll have all that information on our website after our newscast at KIITV.com.